Good morning. I'm Dr. Dana Hawkinson, the Medical Director of Infection Prevention and Control, in for Steve Stites, our Chief Medical Officer, and we are coming to you from the Dolph Simons Jr. Family Broadcast Studio. Today we have the Ginger Squad in with Amanda Cackler, the Director of Quality and Safety, who is here to help us answer your questions. We are also surrounded by colorful artwork here in the studio. We will bring on a special guest after we answer your questions to explain all of this. It's a good story and you will definitely enjoy it. First, I wanted to share our overnight numbers. Hays has 1 active infection and 2 in that recovery period. And here at the hospital at KU, University of Kansas Hospital, we have 7 active infections. We don't have the actual number of recovering infections at this point. Something went wrong with our software, but we do have 7 active infections. Of those, 6 are symptomatic. And of those 6 that are symptomatic, 5 have no vaccination at all. 1 does. And of those 7 active infections, we have 3 in the ICU and 1 on the ventilator. So again, a majority of our patients that are here have not received any vaccine and are not fully vaccinated. So it is interesting to note and important to note that vaccination really does improve and decrease the amount of hospitalizations from COVID-19. So before we move on to our questions, are there any media questions?
Hi, good morning, Doc Hawkins. Taylor from Channel 41.
Hey, Taylor.
I had a question because I feel like we haven't talked about, at least I haven't asked about in a while, the latest on Miss C with kids and COVID right now. Obviously, that's becoming even more of a conversation with children now able to get the vaccine, at least a certain age limit being able to get the vaccine. But those younger kids that are not able to get it still, what more have we learned about? What's the latest that you've been able to glean about multisystem inflammatory syndrome right now with kids and COVID?
You know, we do understand that younger age groups are becoming a larger proportion of the number of people or of the groups infected, and that is probably because of vaccination. I don't think that we have seen any increases or surges in the MIS-C or multisystem inflammatory complication in children. Here we had our pediatrics colleagues on last week. Didn't see an increase. You know, we have had a few here at the health system. We know that our colleagues at Children's Mercy have also treated a few as well. But locally in our hospital, we haven't seen an increase. But we know that that risk is out there. Very small compared to, say, adults that get ill and have to get hospitalized and go to the ICU. But we still know that that risk is out there. And, you know, we believe that if you can cut down on that whole spectrum of disease from COVID-19, by vaccination, you're also going to reduce that chance that your child will get Miss-C as well. That help?
Follow up? Are you good?
I'm good, thank you.
Okay.
All right.
All right. So, should we go to questions from the community?
Yeah, we
know
sure
that
can. Before we
lot.
start with the written ones, Donna wants to know, is anemia a possible side effect of COVID vaccine?
Yeah, you know, we know that the vaccines can have any number of side effects. We know that people can input whatever really they want into the VAERS, which is one of the ways to report adverse events after vaccine, any type of event. But we also know that anemia is a very common medical condition. Many things can cause anemia. Just having chronic illnesses like diabetes or COPD or anything can cause anemia. We know that if you have an acute change or blood loss like a GI bleed, that can cause anemia. So we need you to really understand that if you have anemia, probably get evaluated by your physician, but I'm not aware of a specific cause of anemia. We certainly haven't seen that. We have seen other causes of hematologic side effects like the thrombocytopenia and the blood clotting that we've seen associated with the Johnson & Johnson vaccine, but specifically anemia, I don't think we have seen that. And again, there can be a lot of causes of anemia.
Okay, and Marty wants to know, what about folks who have COVID-19? Are they safe to be around after 3 months from infection? How does getting vaccinated help at that point?
Yeah.
So the question is, if you've had a history of COVID-19, are you safe to be around? And
After 3 months.
Oh,
3 months
I mean,
have gone by.
usually we say that you just need to have that isolation of about 10 days. So really, typically after 10 days, as long as you don't have any active symptoms, you're safe to be around anyone who's had a history of COVID-19.
And the second part was, how does getting vaccinated at this point help if I've already had it?
Yeah, so I think we know that having it naturally does help or you will have an immune response, but we also know that the vaccine can bolster that immunity, and so I would continue to recommend getting the vaccine even if you've had COVID-19.
Yeah.
Okay, and Jean wants to know, are there any fully vaccinated in ICU or on a ventilator?
So this morning, I believe we only had one patient on a ventilator, and I'm not able to recall if that is the one patient. I will say that we have a patient who's not in the intensive care unit who had both of their vaccines in early March, and came in asymptomatic with a COVID-19 positive test. So we're working that person up with a breakthrough infection, but was asymptomatic. And then I don't know, you have it right in front of you, if there was anyone else who had fully vaccinated in our intensive care unit.
Yeah, I don't have it.
I know I didn't break it down by who's ICU and who's not.
So we
this
have,
morning.
we have everybody housed in one unit. That is our cohort unit for those that are symptomatic with COVID-19. And of those, 3 are ICU status and 3 are just typical medical surgical status. But we don't have it broken down because in those symptomatic patients that are in that cohorted unit, only one of those patients has been fully vaccinated. So I can't tell from this here if that patient is
And usually when
ICU
I'm
status.
drilling into that, folks who are fully vaccinated are coming in asymptomatic. That is typically what I'm seeing. There may be 1 or 2 cases that I've seen where they've been fully vaccinated and also symptomatic. But when I see that, those are also folks who typically have chronic conditions, many significant other conditions that are contributing to the likelihood of their admission, whether it really was COVID-19 worsening condition or if it was maybe related to their other chronic diseases.
Debbie wants to know, Dr. Hawkinson, how are the baby hawks after they've been vaccinated?
They're good. They're good. My daughter, who is 12, the morning before I was taking, right before I was taking her to school, the morning after the shot, she still had a little bit of shoulder ache, but she actually asked me, when will I start having symptoms? So she was doing well from a systemic standpoint, meaning no fevers, no muscle aches, no chills, no headache. So she was doing very well. And then by later on that day, so probably 30 or 36 hours after the initial vaccine, their shoulder pain had resolved. So they're doing very good.
All right, so let's get to our questions that we had left over from the week. Question number 1. My 13-year-old had a mild case of COVID-19 in January. Do we need to rush to get her vaccinated since she likely has immunity? How long should we wait?
So I think we kind of touched on this with the earlier question, and I don't think you should wait. I think you absolutely, there's still benefit of getting the COVID-19 vaccine, even if you've had COVID-19. So I wouldn't wait. If you have the opportunity, go and get it.
Yeah, I wouldn't rush, but definitely, if you can get it this weekend, we know that there are plenty of places that have walk-in appointments available. I would definitely go get it. We do understand that immunity by the vaccination is probably a little bit more robust than by natural infection, especially mild disease as well. And the typical guidance from the CDC is that there is no minimum time between your infection and your time to get the vaccination. We just wait that it's more than 10 days so that you can fulfill that 10-day isolation period.
And Angela has kind of a clarifying question. It reads that perhaps she has not had COVID. And, if she did have COVID, she's not vaccinated. She wants to know, or someone she knows, can you get COVID and be asymptomatic again and continue to spread the virus?
So if you've had it before, you might have it now and you're asymptomatic. Could you still be transmitting it?
And you're not getting the vaccine.
And you're not going to get the vaccine. I think there's probably a risk there.
Yeah.
I don't know the exact percentage or likelihood of a reinfection, and then the transmissibility associated with that getting it again. But what we know is that the vaccine is helpful at preventing that transmission. I think my response to that would be to encourage vaccination.
Yeah, and we know from early studies when reinfection was first noted, fairly early on in the pandemic last year, some people that they had on their reports were less symptomatic and they were doing well, but some people were more symptomatic and actually had to go to the hospital and had fairly bad outcomes. So if you get reinfected, you could be asymptomatic. That is certainly one way that it could go, but we don't have any data or information about your ability to transmit and what type of how much viral replication is going on, so that you can continue to spread it to others. So the best advice is to really to get vaccinated.
Okay, next question. The coronavirus variant, first detected in India, has been identified in dozens of countries. It is now designated by the World Health Organization as a variant of concern. What does that mean to us living in Kansas?
I think the simple answer is, what does that mean? It means that we should all go get vaccinated, because we do understand that vaccination does provide protection against these variants of concern. Not a lot of information out about the variant detected in India, but the more concerning ones, like from Brazil and South Africa, we show that the vaccination continues to have good efficacy, good protection against that whole spectrum of COVID-19, whether it's mild illness all the way up to severe illness, getting you in the ICU. So for Kansas, what that means is go get vaccinated. In addition, I think individually, I will be looking forward to any booster vaccine with those pivoted spike proteins. The spike, we know that Moderna is creating a booster vaccine with the spike from the South African variant. I think I would also like if they could be able to put in the spike from the Indian variant as well. So I'm sure they are working on that. Having a booster vaccine with one or two different spikes of those variants of concern that are spreading around the world, I think is important. And I'm sure that the bright people at Moderna and Pfizer and all of the vaccine companies are working on pivoting their vaccines to that.
The more I read about the J&J vaccine, the more I worry I made a bad choice. Do I have cause to worry, and will I be able to take the mRNA vaccines when it comes time for a booster? And then Donna wants to know what the efficacy updates are on J&J. Is it 70%, 75%?
My initial response is no, it was not a bad choice. I think we've talked about the best vaccine is the one that you have. And so I certainly wouldn't look back and say that was a poor decision. As it relates to the booster, I don't know if the first manufacturer available, if you have to get your booster, I don't know that continuum will be required. And if you want to answer that or address the updates as it relates to efficacy.
No, I agree with you. I don't think that was a bad choice. We know that the Johnson & Johnson vaccine does continue to protect you from that whole spectrum. The efficacy continues to be very high as far as hospitalization, severe disease, and death. The Johnson & Johnson vaccine had a few more pauses and a little bit delay, so we don't have that real-world experience as much yet as we do with, say, the Pfizer vaccine that has been used, especially in the healthcare workers and that Israeli experience as well. And, are you going to be able to mix doses? Say maybe getting an mRNA vaccine or some of the boosters? Probably, but we don't know how that looks. It will probably be safe. We know that those Pfizer and Moderna vaccines are extremely safe. So I think mixing them in the future will be okay. But we need that information, and we need to really identify what is the process that we're going to do that if you do get the Johnson & Johnson vaccine. And then if there is a booster or a variant booster from the mRNA companies, what is that going to look like? Are you going to need to get, 2 shots of the mRNA vaccines or just that one booster? It's really difficult. I know that all of those questions and about vaccine mixing are being looked at and investigated. But overall, yes, I do believe it will be safe, and we'll just kind of have to see how it plays out. And also if AstraZeneca and or Johnson & Johnson does come out with a pivoted or variant booster as well.
Do you think we'll know that in maybe the next 3 to 6 months, or is that more of a 6 to 9 month?
I think early on in May, Moderna produced a preprint of their variant booster, their South African variant booster. They produced a preprint journal article showing that very good efficacy. So I think these things will be coming out, and maybe in the next few months. Again, with Operation Warp Speed, we do understand that these studies have been expedited, and we know that the volunteers all around the world to be getting these vaccines have helped do that as well. So, I do expect some more expedited data analysis and real-world experience as well, with maybe even mixing, because we know that people probably have been mixing, regardless. They may have been in a trial, but then wanted to go get another vaccine. Like our person who asked the question, they may have gotten Johnson & Johnson, but then decided maybe that's a bad choice. I'm going to go get an mRNA vaccine as well. So I think all of those situations are in play. We just need to kind of wait and see the data analysis on it.
Okay, we touched on this next question a little bit at the top of the update, so I'm going to slightly modify the question. So instead of if, but when someone comes to the hospital for medical reasons that are not COVID related, and we screen them and the test positive during that screening, are they admitted to the COVID unit?
If they're asymptomatic, typically they go to the unit where they need that specialty care that actually brought them into the organization. So, for example, like our labor and delivery department, we're going to let you go to the labor and delivery department. And even if you are symptomatic, we want you to be in that area where you get the specialty care that you actually came in for. So in most cases, if you're asymptomatic and we just happen to find you as positive on our admission screen, we don't cohort you. If you're symptomatic, we will make that decision based off of what takes priority. Is it the reason that you came in and we'll put you on that specialty unit, or does it make more sense to cohort you? Especially right now when we are able to accommodate all of the COVID positive patients just on one unit. But in general, we can manage COVID positive asymptomatic patients on any unit.
And we should state that that's in the context of all of our providers and all of our employees in the hospital wearing eye protection and mask. Those are the most important things because of getting it from a respiratory means in through your mucous membranes. And this goes back to day one when we talked about these things. In through your mouth, in through your nose, then getting into your respiratory tract, and then, of course, your eyes as well. Much less on the surface, such as on your clothes or your hair or anything like that. We still use those contact precautions in our cohorted unit, but just as Amanda said, if you're asymptomatic, the important thing is in the context of everybody wearing eye protection and a mask.
And so now I have personal questions follow
Yeah.
up. One is, is it possible they could spread COVID, even being asymptomatic?
Yeah, I think
There's
we
a
know that
possibility.
there's a risk of that. We know that risk goes down if you're vaccinated.
Yeah.
But that is something that we also take into consideration. I don't know if this is where you were going with that, but we have a couple of units that are semi-private, so you have a roommate. And so we make sure that we have that we have that test result before we put them in a semi-private room.
Yeah. And then the second one is, do you count these people that you're talking about that are not technically on the COVID in the COVID numbers?
Yes.
Yeah. Yep, like I said, today we had one asymptomatic who's on their, not on a cohorted COVID unit, and the other 6 were symptomatic and are on their cohorted COVID unit.
Okay. Next question. I got a huge rash on my arm after receiving the Moderna vaccine. It went away after a couple of days, but will future boosters also leave me with a rash?
I feel like this question was addressed yesterday when you had dermatology on.
Yeah.
And I think he said most of the time the rash, it may come back, but it may not be as severe. But there's also maybe been instances where it comes back, it's the same, but it goes away. And so I think that's the takeaway, is that it is temporary.
Yeah, I actually had to address this question today from one of our enigmatic and great cardiologists, talking to you, Dr. Charlie Porter. He had actually gotten his second dose of COVID vaccine, 14 weeks ago, but also in keeping up with routine health care, which we all should be doing, and talking to our primary care doctors about getting those vaccinations we need. Developed a sore arm and swelling in the arm 2 days after a shingles vaccine. So it is really well documented, and it's on the CDC website, that even for shingles vaccine, a couple days to 2 to 3 days later, you can develop that increased shoulder or arm swelling and pain. So it's not just these COVID vaccines, but it's any vaccine that can lead to those types of reactions and effects. But the recommendation is still to go ahead and get that second dose. Finish those series as you need to. And again, these side effects are not just isolated to COVID vaccines, but can be seen with any of these vaccines.
And Sherry has kind of a related follow-up question. She says Pfizer is working on making the vaccine easier to manage in regards to refrigeration at low temperature. Will that mean more preservatives in the vaccine, and will that need to be tested against side effects?
Yeah. So on the FDA briefs for Moderna and Pfizer, they do distinctly state there are no preservatives in these vaccines. Both of the vaccines have about 9 components. One may have 10, but they do state these are preservative-free vaccines. So I think just starting there and understanding that they're not there are components, but these are not preservative components.
Okay, and Jennifer, thank you. She says she loves all the beautiful artwork, and we have not yet disclosed where it's coming from. We're going to do it as soon as we get done with all the questions, so stay tuned. All right, next question. My mom has rheumatoid arthritis. Her serology test for COVID-19 antibodies taken 3 months ago after being fully vaccinated came back negative. Does it mean that she has zero protection against COVID-19 and will forever need a mask?
Yeah.
I think the simple answer to that is no, that is not what that means. But as far as it relates to measuring the antibodies after vaccination, we know that those aren't really correlated.
Yeah.
And I think it has to do with what is actually being tested from the antibody test, and I'll let you actually speak to the science there.
Yeah, no, I would agree with your simple answer, no. And there is, again, more expert. So first of all, there is guidance that if you are non-immunocompromised and, say, quote-unquote, a normal patient getting a vaccine, you do not check antibodies or serology after vaccination. One, there's no data to see the correlate of protection, and 2, that antibody you're testing may not even test antibodies to spike. The other thing is, in some of the immune-compromised populations, such as solid organ transplant, some of the expert opinion continues to be do not check antibodies after vaccination. Why? Because we don't fully understand the correlate of protection. We don't understand what a negative or positive antibody would mean, because you also do have other components of the immune system, such as the T-cell response. So really the guidance is don't check antibodies after vaccination. But what you want to do is continue to do those non-pharmaceutical interventions like masking, like distancing. Also understand your risk and benefit of whatever situation you may go into. And most importantly, please talk with your medical team and that group that is providing that immunosuppression if you are on immunosuppression.
How much does a COVID-19 shot cost?
This is the best question, because COVID-19 vaccines are free. All of our mass clinics are providing them free of charge. Many of the walk-in locations are free of charge. And then it may be a little bit different if you're at a physician office getting a typical medical treatment or evaluation. There may be a charge associated with that billed to your insurance, but anything in the mass vaccination clinics are free.
But even then, it shouldn't result in a charge to the patient.
That's correct, absolutely.
Correct. Yeah. Okay. So Isaac has a question that kind of goes along with the shot, and it's sort of a philosophical question. Isaac always has the best questions. He said, recently I read some people have questioned the wisdom of making booster vaccines now because they may turn out not to be needed. And meanwhile, large parts of the world still haven't received a first dose. What are your thoughts on that?
Yeah, I mean, I think there are several issues there. I think many parts of the world have not received a first dose. Yeah, I mean, I do think that is tragic. I think we are very fortunate here in the United States to be able to do that and have that glut of supply. Unfortunately, we don't have the demand. So I think that's an issue there. And we know that America is increasing their supply to the rest of the world for vaccines as well. So I think that's important to note. We do have some social conscience and are trying to help the rest of the world as well. As far as the boosters, I am certainly at this point all for the boosters, understanding about the virus, about the variants, and about our immunity. Although the current vaccinations do provide very good, robust immunity and efficacy against those hospitalizations, severe disease, and death to all of the variants identified, I would still prefer to increase and optimize my immunity. And I think that if we can get the vaccine companies to pivot to those variants of concern and direct vaccines against those variants of concern. Right now, mostly it would seem to be the UK variant and possibly that Indian variant. Then I think that's going to be important. I'm sorry, not the UK, the South African variant and the Indian variant, because of those several mutations, which make it a little bit easier to maybe evade some of our immune response. I think that's going to be important. So I would certainly be advocating for the vaccine companies creating those updated and booster vaccines, just as flu is done every year with the influenza vaccine, and doing that and getting those boosters.
All right, 3 more questions, and then we're going to explain our artwork.
Yeah.
I heard that poor oral health and gum disease can increase my chances of getting COVID-19. How? And does it work the other way? Will COVID-19 weaken my gums and teeth?
I have not seen the correlation of poor oral health and gum disease increasing the chance of COVID-19. I think that transmission dynamic is the same whether you have good oral health or poor oral health. I think it's, the key component of that is we know that social distancing, wearing a mask, and vaccination are really critical elements of preventing COVID-19. As it relates to oral complications following the disease, I don't know the specifics on that, but would imagine there's probably something.
Yeah. So, taking that last question, as far as will it weaken your teeth? I don't think we have any evidence of that. I don't understand and see that we have any real reports or evidence of that. But I would be more concerned about poor oral health and gum disease, not necessarily increasing your chances, but there might be more socioeconomic issues. So we know that people and disparities in health and inequality can affect your health care. We know that minority groups, especially in those socioeconomic areas where they may be living closer together, may not have as high of income, may not have access to that health care. And we know that there is health care access out there, but I think even harder than health care is dental care as well. And dental care is so important, and oral health is so important for overall disease states. I've had the patients that I've had that are happiest with me in the hospital are the ones that I've advocated and been able to actually get their teeth pulled because they are in pain every day. Poor oral health. So I think that poor oral health is maybe more a function of just general overall access to adequate health care rather than the disease state itself.
All right. Recently, the Pan American Health Organization reported 40% of the world's COVID-19 deaths happened in the Americas. That sounds high. Are you still seeing deaths from COVID at the health system?
Yes, unfortunately, we still continue to see it. It's definitely at a smaller rate, but that's probably linked to the amount of inpatients that we're seeing. But we've had several deaths even just this week. I think it's important to acknowledge, though, that the way that we're capturing that is if they've had any positive COVID test at all, whether it's the primary reason they're here or whether it just happened to be. So that's how we are capturing ours, but we have had several this week.
And I think we go back to, I believe the United States is the worldwide leader in deaths in general. And when you're talking about the Americas, you have to also understand that South America, that's Brazil as well. And we know Brazil has been very hard hit recently also. So I think it's a combination of all those things. But recently, the other thing we haven't seen as much, and certainly I think the velocity of the number of deaths has improved, and that's because of vaccination.
Okay, last question, then we're going to bring on our special guests.
All right.
Should high school athletes be vaccinated for COVID-19 prior to participating in sports?
Yeah, and we know that it can prevent the spread of transmission, so I think the simple answer to that is yes, and it's safe for the high school aged athletes, so I think that'd be a fantastic idea.
I would agree. Certainly advocate that. Again, it's going to help, I think, keep them individually and physically well. And it's also going to keep them from really having to miss participation days, practices, games, traveling, anything like that. All right. Any more questions? No? Okay.
We do have just one from Joe Ellen. She says, I'm over 70 and fully vaccinated, and I started a fitness class last night inside with 8 people and socially distanced, and I wore my mask. Can you speak to the safety of inside gyms just one more time?
Yeah.
So I'm going to take 2 stances on this. One, we know we've always said outdoors are safer than indoors. However, we also know that the CDC's recent publication of fully vaccinated people is that you can participate in indoor activities with unvaccinated people without a mask. I think it's still important to acknowledge what's going on around you, and really it's a personal decision as to whether or not you want to continue to wear that mask. But I think we are leaning towards it's probably a safe activity.
Yeah, I would certainly, we do understand, just as you said, in indoor spaces and poorly ventilated, especially with other people, you have to identify and understand your risk and benefit. If you're fully vaccinated and masking, you're probably going to be about as protected as possible. But we do know that those super spreading events can occur. There was a recent publication in Emerging Infectious Diseases, one of the CDC publications, about something that happened in China where they were able to identify a super spreading event of over 150 cases from these types of workouts. So, personally, I'm still a little bit reticent about doing those classes and things of that nature. But you have to identify and understand who is it that is going to be in that workout class with you. Do we think they're fully vaccinated as well? And it's all of those little details and understanding that, and then making that judgment for yourself of how safe do you feel. But again, you being vaccinated and masked as well is going to significantly reduce your chance of infection and, of course, the spectrum of disease of COVID-19.
All right.
All right.
Listen to our guests.
All right.
Okay.
So we promised to explain this colorful artwork around us. And earlier this week, nearly 30 hand-painted canvases were delivered to the health system by our next guest, Bridgette Patterson. We had a room to display 18 of them. The paintings reflect good thoughts and well wishes for nurses and all they do, especially during the pandemic. On each canvas is a printed thought. Some are quotes, others are personal messages, like this one from Donna, who writes, "Nursing is not for everyone. It takes a very strong, compassionate person to take on the ills of the world with passion and purpose and work to maintain the health and well-being of the planet. No wonder we're exhausted by the end of the day." So Bridgette is Program Director of the Epilepsy Foundation of Missouri and Kansas, and she joins us now.
Thank you.
Thank you. First of all, I just would like to thank you for these gifts, which will be displayed here at our hospital. Each painting is named in addition to including a quote. What inspired the Epilepsy Foundation to do this artwork, and who are the artists?
Our Studio E program is for individuals with epilepsy. They can be children, they can be adults. We hold our sessions at the Orange Easel School of Art. There's a studio in Liberty, Missouri, and also one in Flatwoods. These were done at Flatwoods. Allison Jensen is the owner, and she's just fabulous with our community. So we created this as kind of a twofold thing. One of our sweet artists, Megan, she came to me after we highlighted her in our gala last year and said, just thanking us for all the ways that we had encouraged her and her family. And she just said, can we do a project sometime that we give back? And I'm like, absolutely. So I listened to your show on a regular basis, and Casey Pickering was on, and she was talking about how during the huge influx of patients there at the University of Kansas Health System, and how at that time when you were so inundated that people were asking about how the nurses and the staff and the physicians were doing. And then a few months ago, I was watching again, and she was on your show as a guest, and said, now that we don't have the volume of patients, people aren't asking anymore how we're doing. And that just struck a chord with me. And that's how this whole project came to life. We just wanted to give back and thank the healthcare workers at the University of Kansas, and for all the dedication and that you've given to our community during this COVID pandemic.
Well, they certainly are vibrant. How many people are living with epilepsy in our region, and how has the pandemic impacted them?
I think generally the impact of the pandemic has been because there's certain triggers that can affect someone's epilepsy. So stress, anxiety, high fevers, those kinds of things can be precipitants for epilepsy. And I think that's probably been the biggest concern, because there's been challenges with kids being virtual in their school settings, for adults in their workplace. So that's brought on some stress and anxiety, and just different ways to how to navigate that. In our region, statistics show us that 1 in 26 will develop epilepsy at some point over the course of their lifetime, and 1 in 10 will have an isolated seizure event. The CDC reports that we have in our region around little over 91,000 individuals with active epilepsy.
So now you do have a gala coming up. Can you tell us about that and how our viewers can help as well?
Yeah, we do. It's this Sunday at 6 p.m. It'll be virtual, so you can go on to either our website, www.efmk.org, and click on events, or this link will get you there as well, and you can register. We'll be highlighting our Fund a Need. We've got some wonderful corporate sponsors. The Comprehensive Epilepsy Center there at KU is always a proud sponsor of our gala, and just come and join us, and you can, there's several action items that are available. We would love to donate to our Fund a Need. We're going to have some really good patient stories that we'll be airing and for folks to view during that time. So, and these monies that are raised go to help us continue our support of the community through our programs and services and advocacy.
All right. Well, thank you very much, Bridgette.
Thank you.
Yeah. And Monday, Jessica Calendar-Rich, who is a member of the White House Coronavirus Commission for Safety and Quality in Nursing Homes and our geriatric medicine physician and expert, is back to tell us what's happening in long-term care facilities and what we all can learn from a recent study published in the New England Journal of Medicine. So, in the week since the 12 to 15-year-old age group has been approved to get their vaccine, we have given more than 100 shots. This includes 14-year-olds Morgan Smith and Andrew Goldsberry. Both are finishing up 8th grade and looking forward to being fully vaccinated to gather with friends, family, and go on vacations. It was also special for the person who gave them their shots, Morgan's grandmother, Dr. Ann Smith. She is a retired family physician who wanted to help the community by volunteering at the University of Kansas Health System Vaccine Clinic.
I think it's wonderful. It makes me feel very good about our teenagers, that they are concerned about the community and that they are accepting of vaccines, and I'm very glad to see their excitement.
I was really, really excited. My first thought was that stuff was finally getting back to normal, and that I would get to hang out with my friends this summer and go to high school in person.
Me, my uncle, my grandpa, my cousin, we're all planning on going up to Minnesota and fishing.
So we want to see more videos or photos. You can upload images using Facebook Messenger here at the Kansas Health System, or send to us at medicalnewsnetwork@kumc.edu. Final thoughts?
Yeah, I used this last week, but it sounds like it's going to be another rainy weekend.
Yeah, I know.
A great rainy day activity would be to go and get vaccinated.
Get vaccinated.
Or a sunny day activity. Just go get vaccinated.
Yeah, I agree. It's supposed to be rainy, but if you can get outdoors and go walking and enjoy the outdoors when it's dry and not raining, go ahead and do that. Otherwise, please encourage your bubble, the people you care about, to go get vaccinated. I think that'd be a great weekend activity.